erectile dysfunction is probably much more common than any of us are willing to admit or talk about. I would say a significant number of people past the age of 40 will have some degree of erectile dysfunction. Now that's relative. Not everybody goes from 60 to 0. So people may not be able to function at the same level as when they were 20 years old, but it might still be okay. As one gets older, what we find is that the erectile function does diminish over time. There is a natural decline in the testosterone level, which may or may not be a factor. There's also the issue with elevated cholesterol, diabetes, all these other conditions that can be associated with decline in erectile function. For example, if a man suddenly presents with difficulty with erectile dysfunction, we frequently look for heart disease because at the end of the day, they're both organs which involve blood flow and blood flow in smaller arteries. So there's a correlation there also. The bottom line is that most people with erectile dysfunction can also be treated. It just depends on how motivated they are, and the treatments can vary anywhere from just some counseling, lifestyle changes, stopping smoking, management of the cholesterol and diabetes, taking the blue pill or the variants of many different types of pills that are of the same family, injection therapy, which works very, very well, but involves the man injecting himself in the side of the penis. And in the ultimate patient, in well-selected patients, a fabulous choice might be a penile implant. But you have to tailor the treatment to the patient. So a lot of people we would never talk to about penile implants because we think they're not good candidates. On the other hand, if we have a 50-year-old male who otherwise is in great shape and, for example, has had a prostate surgery for cancer and can't get an erection, he might very well be a very good candidate for an implant. So you really kind of have to tailor the treatment to the patient. It's not really that certain surgeries are too big to be done. It's just that people have to be motivated and know that once one gets into the realm of surgery, there are some increased complication rates, there's some increased pain and discomfort, and the patient has to be able to buy into the fact that based on his situation, that is the best for him. And once we get patients to that situation where they know what we're doing is best for them, then usually the situation takes care of itself and the outcomes are very good.